Hello and welcome back to A1C to Z, the ABCs of diabetes. I know I haven't posted any videos in a while. I have been recovering from surgery, nothing major. I had my gallbladder out about a month ago, and the surgery was quite a bit more complicated than I thought it would be. I figured I would have my gallbladder out and be back to work in a couple of days, and that wasn't the case. And then after I did recover, I've been trying to get caught up on things that had been kind of pushed to the wayside. But anyways, I am back, and today I have a special topic of interest. I would like to talk to you about hypoglycemia. Hypoglycemia is a very serious issue with patients who have diabetes, especially patients who are on insulin or patients who are on a medication like glipizide, glyburide, or glimepiride. These medications can also cause hypoglycemia. And if you've ever had an episode of hypoglycemia, you know how scary that is. Unfortunately, it is always a possibility anytime you're on insulin or a medication that makes your own body secrete insulin, which is what those other medications I listed do. And what happens then is patients become very afraid of having another episode, and so that maybe they don't take their medications the way that they're supposed to, or they miss doses, or they only take a partial dose and things like that. And so what that does is it leads to the diabetes not being as well controlled as what we would like. There are ways that we can prevent hypoglycemia as much as possible. We can start by recognizing the warning signs, carrying, little candies around in case if the blood sugars do start to drop, and other things that we can do to minimize that concern. So let's talk a little bit about the manifestations of hypoglycemia. What are the things that usually people will experience when their blood sugars are low? So hopefully you don't get to the point where your blood sugar is so low that you're unconscious, because that can happen. But typically with a blood sugar less than 70, some people normally have blood sugars in the 60s. If your blood sugar is in the 60s and you don't feel like your blood sugar is low, it's usually okay. Anything less than 60 is definitely a concern, and some people may feel symptomatic with a blood sugar less than 70. Some people actually feel symptomatic even with blood sugars in the 100s, 150s, and things like that, because they're not used to having a normal blood sugar. So even though those are not dangerous levels, they feel like their blood sugar is low. They don't feel good. And so we have to get their body acclimated to having those normal blood sugars, because over time, if the blood sugars are not well controlled, then the patient is going to have a lot of damage to their organs, and that's what we want to prevent. So when you have hypoglycemia, which I just told you what the definition of that is, the things that you may experience range from shakiness to confusion, to just not feeling right or feeling clammy. There's an old saying that says, it says, cold and clammy, need some candy, hot and dry, sugar high. So remember that. If you feel hot and dry, like your mouth is dry, you're feeling dehydrated, you're urinating a lot, you're drinking a lot, your blood sugars are probably high. If you are feeling cold and clammy, confused, maybe some numbness and tingling in your lips, or anything out of the ordinary, there's a good chance that your blood sugar is too low. And so what you need to do is either you can check your blood sugar if you just feel like it's maybe getting just a barely low, just to check, or you can just carry some little hard candies with you, glucose tablets or something like that, and suck on one. Usually what you want to do with the hypoglycemia is you want something that is going to be simple carbs that are going to be absorbed very quickly to bring your blood sugar up. And so that would be like a little piece of hard candy or something of that nature. And then you want to do something which is going to maintain your blood sugar, like eat a meal or eat some protein and some carbs with that. And hopefully then we can prevent it from dropping again. The other thing that we can do if you tend to have a lot of low blood sugars is, one, make sure you're on the right kind of medications. make sure you're on the right doses, make sure you're getting these medications at the right times. All of those things are very important. The other thing that we can do is something called a continuous glucose monitor. So there's a couple of different models on the market. Some of them are an actual device that has to go through insurance approval, and some of them you can buy at any pharmacy. And typically, they may or may not have insurance coverage. Sometimes the insurance companies see them as a luxury, and so they may not cover them. But I've been told that the price out of pocket really isn't that bad, considering that it continuously monitors your blood sugar 24 hours a day and alerts you if your blood sugar starts to drop too low. And basically, without sticking yourself, you can swipe a device next to the sensor on your arm and check your blood sugar however many times a day you want. So to me, I think it's definitely worth the cost to have that convenience, especially patients who have what we call hypoglycemia unawareness, which is very dangerous. So basically their blood sugars can drop very low and they're not even aware. And usually that happens because they tend to frequently have low blood sugars. So those patients definitely need to be on a continuous glucose monitor, because you can have very bad outcomes from having a blood sugar that's too low. Your brain needs sugar in order to continue to function. Otherwise, I think that's all I had to say about hypoglycemia. But if you have any questions or concerns, feel free to leave it in the comments. Please share my videos with any healthcare providers, nurses, nursing students, patients who have diabetes, friends, family members, anybody who you think might benefit from the information and the content herein. I will hopefully be releasing a couple more videos soon, and I want to start a weight loss series in the next few weeks, all about weight loss and perhaps my own weight loss journey, and hopefully you guys can join me with that, and we can see how much weight we can collectively lose to try to manage the diabetes better. If you have any questions or concerns, just let me know and I'll be happy to answer those for you. Thank you.